Welcome to The Explainer. Have you ever wondered why just being a little dehydrated can make you feel absolutely terrible? Well, today we're going to get into exactly why that is. We're talking about the critical, high-stakes balancing act of fluids and electrolytes that's happening inside your body right now. So that feeling, why does it happen? It really all comes down to this incredibly delicate, high-stakes dance happening inside every single one of your cells. And to really get what's going on, we first have to understand the forces that are, calling the shots. Okay, so to wrap our heads around this balance, we've got to look at three fundamental forces. These are the things that are constantly pushing and pulling fluids through, well, every single part of your body. All right, first up we have osmosis. And I love this analogy. Think of water as cocoa moving through marshmallows. Water just naturally wants to move from a place where there's less stuff dissolved in it, we call that low solute concentration, to a place where there's more stuff. It's always trying to even things out. Next, we've got hydrostatic pressure. This is basically the outward push of a fluid against the walls of whatever's holding it. The perfect example? Your blood pressure. That's literally the hydrostatic pressure of your blood pushing out on the walls of your arteries and veins. And working against that push is a pull. That's oncotic pressure. It's a pulling force, and it's mostly created by big proteins in your blood, like albumin. You can think of these proteins as little magnets that hold on to water, keeping it right inside the blood vessels where it's supposed to be. Okay, so now that we have these forces in mind, this push and this pull, let's take a look at where all this fluid in our body actually lives. Because, it's not just one big swimming pool.
So you might think that most of your body's water is in your blood, right? But that's not the case at all. The vast majority, a full 2/3 of it, is actually inside your cells. We call that intracellular fluid. The other third, that's what's outside the cells, floating around in the spaces between them, and yes, in your bloodstream.
Yeah, this is where problems can start. Imbalances happen when that fluid gets too watered down. That's called hypotonic, and it makes cells swell up like little water balloons. Or it can get way too concentrated. That's hypertonic, and that makes the cells shrink and shrivel up. And let me tell you, both of these are really bad news, especially for your brain. So we've talked about the fluid, but what about the stuff dissolved in it? Let's meet the solutes, or as we call them, the electrolytes. These are tiny, tiny particles that carry an electric charge. They're basically the sparks that power your body. They're absolutely crucial for everything from sending nerve signals to making your muscles contract.
Okay, let's kick things off with the big one, sodium. Sodium is the main electrolyte you'll find in the fluid outside of our cells, and it's so important for nerve impulses and muscle function. And look at that range. The body keeps it incredibly tight, between 135 and 145. That's a super narrow window.
And here's what's both fascinating and kind of scary about sodium. It doesn't matter if you have too little, that's hyponatremia, or too much, hypernatremia, the result can actually be the same. Really serious neurological changes. We're talking confusion, even seizures. It's just a crazy reminder of how sensitive our brain is to this delicate balance.
To help remember the signs of low sodium, a lot of clinicians use this handy mnemonic, salt loss. Every letter stands for a symptom, and when you look at them all together, you can really see this progressive shutdown of the nervous and muscular systems that happens when sodium drops too low.
Now, on the flip side, for high sodium, the mnemonic is fried. And honestly, it's perfect, right? It totally captures the signs of a body that's basically been dried out and become way too concentrated, from things like flushed skin to feeling really restless.
All right, next up we have potassium, which is kind of like sodium's partner in crime. While sodium is mostly outside the cells, potassium is the main player inside the cells. And its biggest job? It is absolutely vital for keeping your heart beating in a steady rhythm. And just look at that range. It's even tighter than sodium's.
So here's the bottom line with potassium. Whether you have too little or too much, both can lead to life-threatening heart rhythm problems, which we call arrhythmias. Your heart is just so incredibly sensitive to potassium levels that any major imbalance is a huge deal, a potential emergency.
And yep, there's a mnemonic for low potassium too. ASIC WALT. It's a long one for sure, but that's because the effects of low potassium are all over the place. I mean, it impacts everything from your breathing and your mood to your muscle strength and even your pulse.
And for dangerously high potassium, well, the mnemonic is one you won't forget. It's murder. And it sounds ominous for a reason. It really drives home the lethal potential here, especially for the heart, which can literally slow down and even stop. Okay, so we've talked about specific electrolytes, but sometimes the body experiences these huge shifts in just the overall amount of fluid, and that can throw the entire system out of whack.
So this can look like a few different things. You've got dehydration, which is pretty straightforward, losing more fluid than you take in. Then there's the opposite, fluid volume overload, which you often see with heart or kidney failure. And then there's this really weird one called third spacing. This is where fluid actually leaks out of your bloodstream and gets trapped in places where your body can't even use it. A classic example is the swollen belly you might see in someone with severe liver disease. I mean, the fluid is in their body, but it's not doing any good because it's not in circulation.
See, when things do go wrong, what happens? How does the body fight back and try to restore that balance? Well, it turns out it has some incredibly powerful systems ready to go.
One of the body's most important tools is something called the RAS system. It's amazing. Basically, when your kidneys sense that your blood pressure is getting low, they kick off this whole chain reaction. The end result is that your body gets a signal to hold on to sodium and water, and that brings your blood pressure right back up. It's just a brilliant self-regulating emergency response system.
So, in a clinical setting, how do we help the body out? Well, we monitor things really closely, like daily weights and lab results. We can give specific IV fluids to help correct an imbalance, or use medications like diuretics to help the body get rid of extra fluid. And a huge part of it is just educating patients on how to manage what they eat and drink. So at the end of the day, what's the big takeaway here? It's that maintaining this super delicate fluid and electrolyte balance is absolutely fundamental to life itself. You got these tiny, tiny particles that are orchestrating massive functions like your heartbeat and your thoughts. It's this constant dynamic process, not something static. And when it goes wrong, it's almost always a sign that there's some deeper issue going on. And this whole intricate balance, this invisible, high-stakes dance, it's happening inside you right now, this very second. Just understanding it is the first step. So think about this. The next time you finish a workout and grab a glass of water, you'll know you're not just quenching your thirst. You're actively supporting one of the most profound and complex processes that's keeping you alive.